Hello, this is Lee Schilling. I'm a physician and have been for over 50 years. The following, this is part one. The following is not medical advice, it's food for thought. So, most people are born with perfect health. Some chronic diseases begin around about ages 10 to 12, depending on lifestyle. And disease destroys some of our reserve, and that can cause symptoms. You can have disease without symptoms until enough reserve is affected. Well, to maintain the best health, we need to know what we don't know. That is, the things we think we know and never question, but maybe don't really know. Now, the reality is that change is still going on. When many of us were born, there weren't any computers or cell phones. Today, there are billions. Technology is increasing daily, as is knowledge. As new information becomes available, it upgrades the older knowledge. This is especially true regarding health information. 100 years ago, no person had received antibiotics, and today few people haven't. And what's regarded as true today may not be true tomorrow. Well, today, most chronic diseases aren't cured, they're managed. Treating symptoms but not the cause won't change why somebody is sick. So, where does prevention fit in? What affects our health is our lifestyle. What's that? Well, lifestyle is essentially how you live your life. Many things about health aren't determined by genes alone. Our lifestyles play an enormous role in which genes are turned on or off. And as you can see on the bottom there, genes load the gun, but lifestyle pulls the trigger. Well, you can think of lifestyle as your environment where you work. Do you get much exercise? What do you eat? What are your favorite meals? Do you use tobacco? Do you drink more than one or two alcoholic drinks a day? How well do you sleep? Do you have loving relationships in your life? Are your friends people you care about? And all of these things make up your lifestyle. Genes don't determine everything because our environments can turn some genes on or off, just not eye color and hair color and a few more. Runs in the family. That doesn't necessarily mean it's genetic. Lifestyle and habits run in the family, but they aren't genetic. Well, let's talk a little bit about longevity. And how long should we live? That's what longevity is all about. And you can see in this chart the 10 leading causes of death by age group. Age groups are across the top, and the rank in terms of how long you live is, and what age you are when you die is on the left there. And what surprised me when I first saw this was unintentional injuries. And that's not really related to nutrition unless you're just drinking a lot of alcohol, maybe then. And chronic diseases you can see listed on the right side here, and they're 75% preventable. Something else might make a difference in how long you live. Let's see what that is. Where you were born, maybe. So the longest people live who were born in Hawaii, and that's the longest for everybody, is 81.3 years. Shortest is 74.7, and that's if you were born in Mississippi. So premature death is death before your expected lifespan, and many are preventable. Today's generation is expected to be the first to not live as long as their parents. And yet, if I can provide you with enough information that you become a pretty decent health person and know what to do and what not to do, you may live as long as the people in Hawaii. Now, people in the pictures on the left were not born in Hawaii, but they've all lived over 100. Well, what's cholesterol? That's a pretty important thing, and it's a waxy fat-like substance made by your liver. And blood cholesterol is essential for good health. Your body needs it to make certain things such as hormones and things that help you digest your fatty foods. Your body makes all the blood cholesterol it needs, which is why experts recommend that people eat as little dietary cholesterol as possible while they're on a healthy eating plan. So dietary cholesterol is found in animal foods, including meat, seafood, poultry, eggs, and dairy products, but not in fruits and vegetables. So learn more about preventing high cholesterol by making healthy eating choices. And we come to plaques. And this has a lot to do with why you shouldn't eat much cholesterol. Your body there are two kinds of cholesterol that we talk about here. And LDL is the low density lipoprotein, and then there's an HDL, the high density lipoprotein. Now, the low density is the bad one, and the HDL, the high density, is the good one, because the bad one builds up something called plaques in our blood vessels. And as they build up over time, that narrows the inside of the blood vessel. And the narrowing then diminishes the amount of blood flow to and from your heart and other organs. So when blood flow to the heart is blocked, it can cause chest pain called angina or even a heart attack. So healthy nutrition can make a difference. Your chances of dying from heart disease and stroke depend on many things: age, race, and gender. So men have the highest risk of death across all races and ethnic groups. Black men are most at risk, and they're at the highest risk of dying early from heart disease and stroke. Well, how are you going to improve the odds? And this is part of what this whole course is about, is to help you improve your odds. Plant-based diets improve health outcomes regardless of race. And that was shown in this study that they're talking about here. And they were looking at black and white participants. Both groups similarly improved their weight and insulin and cholesterol and blood sugar with no significant difference between the groups. These findings suggest plant-based dietary food offers clinical treatment opportunities to improve cardiovascular health independent of race. Well, nutrition does play a large part in health. Poverty also plays a large part, and solutions are needed for many health issues that just aren't getting addressed. Because everybody does better when everybody does better. Arterial disease is the source of most chronic disease. Arteries are affected by the food we eat. Too much fat and possibly other foods like sugar in the diet result in the arteries developing plaques. These are like rust in our water pipes. They allow a smaller amount of blood to deliver the oxygen to the organ. Oxygen is critically important, and if the organs don't get what they need, then they get damaged or diseased. And this was interesting. This is a rather complex slide, but the book was written by the doctor above. He's a surgeon, And one of his colleagues came in after having done a surgery. And when you do surgeries, then you have to write orders for the patient to be managed. And so while he was writing orders, this other doctor all of a sudden grabbed his chest and he fell over and was unconscious. So they thought he must have had a heart attack, and they took him down to where they could do a test where you put some dye inside the artery and get an x-ray to see what the artery looks like. And the one on where it says the 27, 1996, and distal LAD, that's an artery in the heart. And it's got a lot of that plaque we just talked about. So he's not getting as much blood flowing through the heart as he should. And sometimes these plaques can rupture a little bit, and that'll form a blood clot that keeps any blood going past there. Well, the doctor in the picture in the book said, come on out to the house since they can't do anything else, and we'll get you fixed up. So they did. He, the other doctor, and his wife. And they started him on a vegan diet. That's where you don't eat any meat, dairy, or eggs. And after 2.5 years, they went back and got another x-ray, and it's all back to normal. I mean, that's an amazing thing. And you can see there are many more blood vessels, all kinds of good things happening. The change that different nutrition can make is shown here. And if you have a little atherosclerosis somewhere, you're going to have it everywhere. Well, he wanted to get a study done to see what caused heart disease. And that was started in 1948, and it was a Framingham heart study. And one of the doctors who was running that says, we tend to scoff at vegetarians, but they're doing much better than we are. Vegans have cholesterol levels so low, they almost never get heart attacks. We've never seen anyone in this study, the Framingham study, have a heart attack with a cholesterol level below 150. And there have been other studies that show the same thing. Well, prevention works best. Nearly 800,000 Americans die each year from heart disease and stroke. Most of the major risk factors can be managed or prevented. Well, how do you do that? Well, all the things that are listed in this list here. High blood pressure, change your diet. And blood cholesterol, check with your doctor. Diabetes, check with your doctor. Tobacco use, if you don't smoke, don't start. And if you do, try to get help to quit if you can. Unhealthy diet, switch to fruits and vegetables. Physical inactivity, you really should probably exercise or be walking around doing things 2.5 hours each week. Obesity, you need fruits and vegetables. They're healthy and help you lose weight. So prevention is the key. And you can see what it is here. Vegans don't eat meat, dairy, or eggs. And then there are lacto-vegetarians, and they drink milk and dairy things. Ovo-vegetarians, they don't eat meat, dairy products, but they do consume eggs. And then lacto-ovo-vegetarian does not eat meat, and they do consume eggs and dairy. And then poultarians, and eggs and dairy. And then pescatarian does consume fish and seafood, eggs and dairy. Just about everything you'd want to know. And if you're watching this at home, you could probably pause your computer and print that up if you can. So why does nutrition matter? Well, to maintain health, our organs need oxygen. And atherosclerosis anywhere is probably atherosclerosis everywhere. And arteries and veins are everywhere in our body. Arteries bring blood from the heart to our organs, and veins bring it back. And one thing that I don't have on here is something called ED, and that's erectile dysfunction. Only occurs in males, and it's probably the first sign, something that could lead to heart disease. So if you're experiencing that and you're 35 and older, it's probably not psychological, but it's probably arterial. And you may want to then see what your personal doctor would say or a cardiologist. When Franklin Delano Roosevelt was reelected in 1944, his blood pressure was 200/100. It's not known if his doctors recognized that that was a problem. 6 months later, he developed a hypertensive crisis, severe headache, loss of consciousness, with a blood pressure of 300/190, and he died shortly thereafter from massive brain hemorrhage. Even in the 1950s, some experts felt it was important to have elevated blood pressure to be able for those with it to get blood to vital organs. Insurance companies recognize that people with elevated blood pressure are more likely to die prematurely and refuse them life insurance policies sometimes. So the normal pressure today is equal to or below 120/80. And the goal is to keep pressure never higher than 120/80. Higher is unhealthy. And how do you do that? Well, you want to eat a healthy diet, stay at a healthy weight, stay physically active, don't smoke, limit the amount of alcohol you drink, get enough sleep. So if you're not doing those things, be sure to get your blood pressure checked, and we'll go from there. Well, diabetes is a big problem. More than 21 million Americans have diabetes, and another 84 million have a condition called prediabetes, and that puts them at risk for developing type 2 diabetes. And we'll talk about the different types in a little bit. Diabetes can cause heart disease, kidney failure, blindness. It's just something you don't want to have, and you don't want to have it and not know it. Well, everybody used to say that obesity was the problem. Now, some studies have been done that would question that theory. And what they found was that more people in the world developed diabetes who were not obese. And so it doesn't look like obesity is the cause. It looks more like something else that you're exposed to is causing it. Well, the different types of diabetes you can see here. Prediabetes is when you have abnormal tests, but they're not abnormal enough to be diagnosed as a diabetic. And what causes that? Well, your lifestyle. Mainly what you're eating. Levels of glucose come from the food that we eat, and then that goes into the blood. And depending on the level of glucose, that's going to stimulate the pancreas to produce insulin to keep your blood sugar from getting too high. It just regulates where it should go. So with type 1 diabetes, the pancreas is not making insulin. Well, why not? Maybe because it got an infection, something within the food, an unidentified component, possibly cow's milk, causing an autoimmune reaction. So we tell moms who are pregnant not to be drinking cow's milk or eating butter or ice cream or any of the things made from milk, because that can cause an autoimmune reaction, and especially true if they're nursing. Then there's type 1.5, and that's latent autoimmune, slowly progressing form of autoimmune diabetes. Type 2 diabetes is what 90+% of the people have. And that's where the cells are resistant to what the insulin does. And that's a problem probably by what you've already eaten in the past. A lot of fat was thought to do this. Processed foods, inactivity, early onset has been reversed. So make sure if you have any symptoms, and we'll talk about that in a minute, get it checked. Living a sedentary lifestyle is not good, and increasing age is another possible cause. Gestational diabetes is diabetes that starts and ends with a pregnancy, and the causes could be a genetic thing with a family history, or if you're overweight or obese, if you suffer from polycystic ovary syndrome, have a large baby weighing over 9 pounds, then you might develop this. And if you do develop it, then it may ultimately go on after the pregnancy to develop into type 2 diabetes. The CDC states the incidence of type 2 diabetes is about 90 to 95% of all cases of diabetes. So in the US in 2018, it's about 34 million people of all ages, 34.1 if you were 18 or older, and 7.3 were not aware of it or they didn't report having it. This is a really important thing, to have it and not know it, because then you can't do anything about it. And if you do something early, you can sometimes just cure it, as long as you continue with doing something to keep it from coming back. The percentage of adults with diabetes increases with age, and almost 27% among those 65 and older. Well, type 1 diabetes, you don't have the insulin, so you're going to need to get it to regulate your blood sugar, and so you'll need pills or injections. Type 2 diabetes, you have the insulin that you need, but it just doesn't get into the cell. And it needs to get into muscle cells because it provides the energy to make them work. Like if you need to lift something, that uses muscles. If your heart beats, that's a muscle. Lungs breathe, you need that also. Kidneys to work, you need muscles. And if you don't have this, how does insulin work? And these two circles here represent muscle cells, and it shows you that the insulin sort of comes into this first thing that says insulin receptor, and what that does is to open the thing next to it, the blue thing, and that's called a glucose channel. And in this first picture is closed with glucose on the outside, but in the second picture, insulin receptor channel to open, and the glucose can come in. Now, in insulin resistance over on the right side, the research is still going on, and nobody knows 100% for sure what causes it. But that channel won't open up, even if the receptor is acted upon by insulin. And if you can't get the glucose in the cell, it won't have any energy to work. So food provides glucose, which causes the pancreas to release insulin. Then the brain regulates where it goes. So these are symptoms not to be ignored. And if you have them, you need to see your personal doctor. And what are they? Well, increased thirst, increased urination. So complications from having diabetes can be prevented or be made less severe with nutrition. And what are some of the complications? Heart attack or stroke, damage to blood vessels, vision impairment or blindness, tingling or discomfort in the arms and legs, kidney disease or failure, sores on feet, legs, and sometimes amputations, and then gum or dental disease. And here you can see diabetic retinopathy, plaques in the arteries, and sores on the feet, and gangrene because the blood can't get through to nourish. Well, how do you maintain good health? Eat a healthy diet, stay at a healthy weight, limit the amount of alcohol you drink, get enough sleep, weigh less than 25 of something called BMI, and we'll discuss that in the next video. Cholesterol should be, the government says 200, but if you don't ever want to have a heart attack, get it below 150. And blood pressure should be no higher than 120 over 80. Don't smoke and be active. Ultimately 45 minutes, 5 days a week. And blood sugar ought to be less than 100 before meals. And don't eat more than 25 grams a day of sugar. And that's for men 9 teaspoons a day. And for females, about 6. And sodium no more than 2,300 milligrams a day, and that's about a teaspoon or 2/3 or 3/4 of a teaspoon. So whose job is it to keep you from becoming sick and suffering, and how do you do it? Well, it's your job. You're the only one with you 100% of the time. And you should keep trying to learn as much as you can about health. Well, today, most chronic diseases aren't cured. They're managed. And treating symptoms won't change why somebody's sick. Treating the cause will. Nutrition and exercise are most important in terms of health. And there are 2 kinds of nutrition, healthy and unhealthy. We need to understand the difference. People who live the longest and healthiest live in countries that don't have gyms. They get their exercise by walking and working and get nutrition from healthy food. Well, which has more calories? A pound of sugar or a pound of butter? And I think we'll answer that in the next part 2. So any questions, except for personal health questions, send me an email. I'll be happy to discuss it with you.